Escozine, an advanced patent-pending nutraceutical product. Medical studies have shown that Escozine's active ingredient, blue scorpion serum, greatly enhances the body's natural ability to fight cancer. At an international conference of oncologists, Arthur Grant McCallion, President and CEO of Medilife, together with Dr. Mario Fulcar, a state-certified oncologist and surgeon, presented case studies which detailed the effectiveness of Escozine. The following is a sample of those case studies. Philip DeMars was diagnosed in 2005 with malignant fibrous histiocytoma, soft tissue sarcoma of the left knee, aggressive form. He received adjuvant chemotherapy, but did not continue it due to the undesirable side effects he experienced. 2 years later, the tumor grew and spread, developing metastatic nodules which compressed the esophagus, resulting in severe dysphagia and pronounced weight loss. By 2007, Philip was unable to feed on his own and had to have a tube implanted so he could receive nutrition. He only received palliative treatment in the form of morphine. His family was devastated. In September 2007, the mother of Philip, Rebecca Del Rio, found out about Medilife's Escozine at an alternative cancer therapy convention organized by the American Cancer Control Society. Philip DeMars expressed a desire to be part of the study of Escozine. He began taking Escozine in October of 2007. Philip experienced progressive improvement. This was immediately evident in a decrease of the metastatic nodules and the cessation of the esophageal obstruction. There was enough improvement that the entry feeding tube was withdrawn. Within a week of taking drops of Escozine, his esophagus opened up enough so he could swallow water and liquids again. After 2 weeks, he was able to begin eating liquid foods on his own. At present, Philip is almost free of pain. There are no signs or symptoms indicating that long-term administration of Escozine caused Philip any side effects or created any dependence or addiction. This scan was taken on June 25, 2007, before Philip began taking Escozine. The cancerous growth can be clearly seen on the right side of the image. This scan was taken on November 19, 2007, just weeks after Phil began taking Escozine. The cancerous growth, formerly on the right side, is now almost completely gone. This comparison of the 2 CT scans shows the dramatic before and after changes from taking Escozine. Stella was diagnosed with ovarian cancer in October 2000. She submitted to a laparoscopic right salpingo oophorectomy. The post-operative result was a borderline mucinous tumor of the ovary. She received chemotherapy by means of cisplatinum 5-FU and mitomycin C. In 2006, Stella had surgery for a 3rd time because of a gigantic retroperitoneal mass which was causing ipsilateral ureteral obstruction. She was also receiving systemic chemotherapy. Despite these treatments, the tumor worsened. Stella experienced a painful intestinal obstruction and a worsening of her general condition. Due to a lack of improvement, it was decided to operate for the 4th time. After the surgery, Stella only received palliative treatments, and her overall condition was highly negative. It was at this time she started using Escozine. At first, Stella didn't believe that Escozine would work for her, but her husband was much more confident, so Stella took it on his behalf. After a short period of time, Stella started feeling a significant decrease in pain, and she was able to stop taking morphine. Today, she is fully functional and has shown progressive improvement. Her level of health has improved to the point of a nearly complete recovery. She continues to take Escozine with the hopes of completely overcoming cancer. In 1999, Effie was diagnosed with infiltrating ductal carcinoma of the left breast. She was submitted to chemotherapy and radiotherapy. In 2005, the tumor recurred with pulmonary metastases. The illness spread to the cervical column and to the hip, which suffered a pathological fracture. This kept her in a weakened state and confined to bed. Chemotherapy was repeated, but after no signs of improvement were observed, chemotherapy was stopped. Effie was dying. The doctors gave her a maximum of 6 months to live. She was running out of hope. At this point, Effie did not receive any further conventional treatment. She became part of the study of Escozine in January of 2004. Effie experienced immediate improvement upon taking Escozine. She felt such a difference, she went to the doctor and asked for a blood test. Effie's tumor marker, CA15-3, had diminished dramatically. A 207-point drop in her tumor marker occurred in the first 2 weeks of using Escozine. After only 3 months of taking Escozine, Effie was able to return to her regular life. In all presented case studies, it was shown that Escozine was safe and well tolerated. When Effie was questioned if she had any side effects, here's what her answer was. Yes, I did have one very big side effect. Now after taking Escozine, wherever I go, I want to talk about Escozine.
And the beautiful thing is, I believe that there really is no side effect, correct?
No side effect. The only side effect this has, honestly, wherever you go, whoever you talk, whoever you meet, the only side effect is you're going to talk about them.
Yeah.
That's the only side effect.
Right.
In the past, there has been a separation between traditional Western medicine and natural approaches to healing. This is partly due to a lack of investment in developing natural products. Meadowlife is here to build a bridge between these two approaches. Meadowlife works closely with oncologists and scientists to integrate the best of these approaches for superior results. The result is a revolutionary new product, Escozine. Escozine combines the best research of Western medicine with the holistic benefits of natural health. Escozine contains the all-natural ingredient, blue scorpion serum. Blue scorpion serum has been used by thousands of people around the world to return to health after periods of terrible sickness. Previously completed third-stage clinical trials have shown that blue scorpion serum is, on average, 89.5% successful against a wide variety of cancers. If you have cancer, there is hope. Escozine has worked for Philip, Stella, Effie, and many others.